Hello, everybody, and welcome back to the Patient First Podcast. I am your host, Dr. Bryan Laskin. And as always, I'm very excited that you're here. And we have an amazing, very cool person in dentistry who is here to speak with us today, Karla-Marie Santiago, MBA, who has over 10 years of experience in the healthcare and dental industry. Her educational and professional experience includes clinical operations, procurement, compliance, faculties and maintenance, and inventory and materials management. Karla is a leader in the execution and collaboration, ownership of strategic initiatives to drive organizational change and industry compliance. She works at Oakpoint currently as the director of procurement. In addition, she oversees the clinical compliance and helps lead high value strategic operational projects. Karla, thank you so much for being on the podcast.
Yeah, you're welcome. I'm happy to be here. Excited.
So I have to tell you, my father worked his entire career at 3M from when he was in engineering school all the way to a couple days before he died. And he ended as the head of procurement.
Really?
And I can barely even say the word. So could you explain what procurement is to the audience?
Yeah, sure. I think procurement kind of gets this misunderstanding that it's only about purchasing, but procurement is actually just it encompasses like purchasing of supplies, contract negotiation, vendor management. So as part of the director of procurement at Oak Point, I would say the biggest responsibility of my role is to develop strategies with our vendor partners, with our industry partners, that will allow us to have like the best value for us as an organization and then for them also as part of our partners. We also are in charge of analyzing the data that comes out of the practices when it comes to supply spend, trying to manage this budget management as well as we assign budgets for different categories in the purchasing area. And like I said, I mean, procurement can be as big as you can when it comes to different categories like IT, supplies, equipment. But mostly I focus more on Oak Point in the clinical purchasing side of things. And it's kind of exciting. I think a lot of people think it's like boring or, but I think if you focus on the strategy and all the benefits the organization can get from it, I think it's pretty nice.
That's a huge piece. And you wear many hats at Oak Point too, it seems like, right? As what tends to happen in dental organizations. So you're really digging into the details of the clinical operations of dental practices, and you get kind of valuable insights into the runnings of a dental practice. So what are you seeing today that is happening at the dental practice level that maybe other people aren't looking at, or opportunities that people have to grow?
Yeah. So as director of procurement, I'm part of the operations team, and we have excellent people leading operations at Oak Point. We have a senior VP of operations, and then we have director of operations, and it gives me like in the procurement side, like a really big advantage to be part of that team because I get to hear like firsthand what's going on in the practices. And I also, as part of my role, like talking a lot with, boots on the ground because it helps me understand what technologies or what supplies or what will be their needs to make things more efficient. The same thing as, talking with the director of operations, whether they bring something to my attention or I bring something to their attention. So I don't know if necessarily this is new, but I think it's something that we continue to struggle with. There are so many new technologies out in the industry right now, great technologies with artificial intelligence and to help be efficient on the operations side, but then they're all separate from each other. And then, so in the end, you can try to achieve efficiency, but if you have, let's say, a front desk person or a practice manager role, having 5, 10 different windows just to access each of those softwares, then it kind of takes away from the efficiency that you're trying to move forwards to. And I think that that's still a struggle, and I think the industry is moving towards the different companies working with each other more and working together. I think we're starting to see a little bit more of that, but that again, I think that continues to be a struggle. And definitely implementation of technologies is always a challenge, especially not because it's just change management, but also because as in a DSOs, depending on where you are in growth, you might not have all the necessary resources for implementation. And then you also rely on your vendor partners to help with that. So I think
Well,
there's opportunity for growth there.
I could not agree with you more. And you probably knew that, but I think, you know, the problem of lack of data interoperability, I think, is the biggest problem in dentistry. It's
Mhm.
the topic of my latest book, and I think it's and what we're looking to solve at Tooth Apps. And I feel like that there's, in my mind, aligning the entire industry into how that is shaped. We can't leave it up. But this is a question. I don't believe, and you can agree or disagree with me, that we can leave it up to vendors to kind of take this into their own hands and just play nice with each other. Because most of the vendors, in my experience, in my educated experience, act like the data that's in their software is theirs to monetize, not the legally property of practices and patients like it is in many instances. So the question I have is, do you kind of agree that this has to be kind of standardized in a way that all software systems in dentistry, all technology companies leverage the same pathways to 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 exchange their information, so that
Mhm.
then we can actually leverage these technologies both individually and collectively more efficiently.
I do agree with like leveraging like more standardized, centralized place where to access the data. And you and I have talked about this before. I mean, the Cures Act, it's a federal law. It states that, the exchange of data and it talks about information blocking, right? So it's not just between the patient and the provider, but also between like healthcare providers to labs, dentists to labs, or, a company to company. So I think it definitely that as it in itself is going to promote that exchange of data. I think also I am seeing a little bit more when it comes to cloud-based practice management softwares, where you see that you might have different technologies that you can actually access within the software. So I think the industries, some of them, are moving towards that and to being like, okay, let's have it all in one platform so that we can exchange the data. One of the things is funny that you say that sometimes they feel like they own the data. I always say when I am doing any strategy or contract negotiations, or I want to improve like the relationship, I always say, do you have a dashboard? Do you have a way for us to see data analytics? What tools do you share with us? Because I want to see, and I always tend to say like, well, it's my data because it belongs to to the practices that we have, to the doctors. So it's like I want to be able to access my data, and I think that's always something that can be improved. I think if you are in the technology space and you're going to be creating a great product, I think one of the first things that you need to discuss is what tool am I going to use to share this data with my customer? And then, like, as a domino effect for them to share with their patients just to improve. I mean, the ultimate goal is to improve patient care. And you are able to improve that patient care, you can make more like resound decisions and more informed decisions when you have everything in one place.
Yeah, I totally agree. And it's called the Patient First Podcast, for
Yeah.
God's sakes, right? Yeah.
Yeah.
So tell me a little bit about Oak Point too, and how you go about taking care of, because I know that obviously patient care is a huge focus of yours, and how you provide the highest quality of care at Oak Point.
I mean, Oakpoint is a great organization founded by amazing core values. And one of our core values is transparency and give the wow, experience. And our CEO, I mean, I've had a lot of different, jobs in the last 10 years that have to do in the healthcare. And I have to say our CEO and our leadership team are very, very into transparency. So I think that really helps with, and then they like, obviously share that transparency with the practices. It's not just at the DSO level, but also at the practices. And I think that right there helps the doctors, again, like provide better patient care, provide that quality of care, because we also give clinical autonomy when it comes to, like purchases of supplies. And, we don't impose a technology. We always try to discuss like, okay, these are the benefits that this technology is going to have, implementing in your practice. So I think that all the way that we approach and partner with our doctors, I think really helps to put the patient first. And our leadership team is very big on analytics too. So we try to work on having as much data as possible that can help us identify trends or, maybe gaps in the practices where we can say, well, it seems that not necessarily, like, let's say the phones don't get answered or patients are not getting access quickly to the data. So we look for those trends and those gaps and say, okay, these are the tools that we can bring to the practices and we can present where they can, improve their quality of care.
That's fantastic. I mean, I loved your answer about your core value of transparency. I think that it's under leveraged within dentistry. Let me put it that way. I was talking to a leader of a DSO a couple weeks ago who, we have our patient application coming, so patients will actually have access to their entire electronic dental records. And as I was talking to this leader, they were saying that it's a little bit problematic because for them, we all know that about 30% of the adults in the US have periodontal disease,
Mm.
but they have practices that are treatment planning 2% of scaling rib planing and periodontal treatment. And he said, I know that that's not going on, but when patients know, that's going to be problematic.
Hmm.
And I said, well, what's the real problem here? Is it that patients know, or is it that the dentists know and they're not doing something about it, or the hygienists know in the practices?
Right.
And that perspective of transparency, I think, is just it's huge. I mean, I think when you talk about putting patients first, at first when you were talking about transparency, it might seem tangential, but it's
Mhm.
actually directly associated with how we care for our patients, and that's the best answer I've heard from that in a long time. So thank you.
Thank you.
Uh,
Well, I
and
I mean,
now
I'm telling you, our CEO, like, it's a great way to work because one, you feel like you're comfortable in sharing the information, and then you can actually, I would say, like, you can have like real conversations with your doctors and say, how can we help? If this is challenge within the practice, then how can we help? Or on the other side, say, hey, like, we're seeing no shows, cancellation rates going up. Is there a trend or what's going on? Like, what's the cause of it? So we always try to, and like I said, our CEO, Mick Janez, I mean, he has shown that transparency is one of the biggest values for the organization. And I think this one of the major successes of Oakpoint.
so I'm big on transparency myself too. And now the only downside of transparency is sometimes you don't actually want to know, right? Like, and so I always say transparency coupled with respectfulness, because
Right.
sometimes like you don't really want to know. So do you have challenges in your organization where people are maybe a little too transparent?
Well, I think it's how did you deliver the message? But sometimes you're always gonna like have like that excessive honesty. Well, I think one thing is transparency, another thing is like, that's excessive honesty and not being able to how to deliver the message. It's you mentioned
You,
like,
you realize I'm really asking for myself how I can be.
no,
And then
no, like, for example, sometimes, when we partner with a doctor, we acquire a practice, we do a compliance assessment. So our clinical compliance manager, they go to the practice, they do their own internal facility audit, and then we also partner with a third party that helps us does like the external audit. And sometimes, when we initially get that assessment, it's, believe me, it's not the percentage that we would want to have for standard of care. And we try to achieve in compliance at least 95% and above. That's our goal with facility audits. We want to have all our practices and open across the board like to be 95% and above, especially in compliance. And then again, compliance is an issue as procurement. Nobody wants to deal with it. But I think, let's say a practice, we have had practices when we first start working with them that are at like 40% or 50%. So it's having that conversation with the doctor. You don't want to tell them that they haven't been doing their job, but you want to tell them that because we want to keep a standard of care that will allow them to provide quality of care, we want to make sure that we do everything, all the actions, everything, all the tasks to get them to that 95% and above, requirements of the state and federal regulations. So I think it's the way that you deliver the message. And we have a lot of people in our team that are really, really good at that. I always joke that I know like how to have these conversations, but I also know when I want something in terms of like we have to do this now. So I think we have great people in the operations team to have those transparent conversations and in our leadership team.
So I have a question. So I spent the bulk of my career speaking directly to dentists and a lot of dentist owners, and there's a lot that are listening now, and I feel like I don't feel like I know that I've been barking at dentists about like HIPAA compliance and now Cures compliance for my entire career. And I get the same reactions, even in DSOs. Like it's like, is this a paper? Will I ever actually get in trouble for this? Right? And it's so refreshing to see within the DSO industry that there's actually great people like yourself that care about compliance and understand that this isn't about not paying fines. It's about delivering high quality care. And that there's actually real reasons behind these regulations that improve everybody, not just patients' lives, but our our the practice runs better. Everything is actually compliance equals better care and also a better workplace and higher profitability. I firmly believe that
Mhm.
across the board. There's not a regulation in dentistry that I think isn't better for everybody. So that being said, what my fantasy is that when you go into a dental practice that has a compliance rating of 40, right, that you're willing to pay less for that practice than one that comes out at 95. Is that true?
I can't. I'm not gonna go into the whole M&A development side. I would leave that to our chief development officer. But it's definitely something that I believe that more DSOs should incorporate in their diligence process. I think there's definitely, I mean, again, there's definitely opportunities there. And sometimes, look, I mean, sometimes we have a great clinical compliance manager, and she takes the time to inform and educate, which I think is the biggest part of it. Sometimes we focus so much. It's like when you have a job and your role, and then you focus on the biggest piece of that role, but then you forget like the other little things that kind of support that role. So I think sometimes it goes to the back burner. I'm not going to talk about valuation of practice. That's out of my, but I think that definitely the DSO side as a whole should be more towards like incorporating those assessments and those compliance, assessment, not just for, on the infection control HIPAA, OSHA side, but also like equipment. When you acquire equipment, sometimes that equipment is not up to standard of care. I mean, and we see that a lot with scanners, with CTs, with, other like chairs, even chairs. So I would say I would like to see more across the industry, including that compliance on the diligence side.
Well, I don't want to put you on the, on the hot seat here, but
Oh
so
no,
I'll
you're
talk
fine.
from my own experience. Like, just think about it logically. If you are a great assistant, if you're a great associate, if you're looking to acquire a practice, right? Are you going to want to buy the practice that has the equipment doesn't work
Of
and
course not.
they're not in compliance, right? I mean, no, no. So instead of thinking about,
Some people
for
do. Some
oh yeah,
people do. Some people have like I call them fixer uppers, and that's their strategy. But we want a practice that is functional. We want a practice that is a healthy practice. We want a practice that has been following compliance and has been providing safe care to their
yeah.
patients. And that
Well, I
definitely
think,
that definitely brings value.
and I see that sort of desire. Well, first of all, in Oak Point, I think it's great, and I think it's a differentiator that you guys do that because I haven't even heard of a DSO that provides like a rating that has third party auditors come in and do checks, and I think that's phenomenal. And it probably, I would guess, I in my mind right now have an idea of what an Oak Point office looks and runs like, and it's much better than other organizations that I would think of. And I don't know anything more than the other people listening right now about Oak Point, other than because that you are doing this, and so I would wager that the quality of care in your practices is higher, the employee satisfaction is higher, that the pride that people are feeling every day in the practices are higher, and that Oak Point is probably driving valuation to practices more than other DSOs just based on our short conversation about kind of how you do what you do there. And so I appreciate what you're bringing to the industry. Thank you very
Oh,
much.
thank you. I mean, we have a great team, and one of the things that I always say is that our leadership team has a great eye for talent. So we definitely have been able to build a really, really good team, not just only obviously at the DSO level, but also at the practice level.
And they're really good at picking procurement officers, right? Yeah.
I try. Not
I
every day
think
is
so.
perfect.
That's a statement, not a question. Well, Karla, thank you so much for being on the Patient First podcast.
Oh,
Very much appreciate you
thank
being
you.
here. Where can people go to find out more information?
Well, more information about Oakpoint is www.oakpoint.us. You can always email me if you have a question. It's Karla with a K at oakpoint.us. We're happy to, I'm always happy to share, best practices with, people in the procurement area or, even operations area. We have a great team of people. So yeah,
Thank you again. I look forward to talking to you soon.
thank you, Dr. Laskin. Bye.